Welcome back to Two Wants to Know. Cone Health's Dr. Zoe Stallings is joining us to answer your questions about the COVID-19 vaccine. This person is asking, I've had both vaccines a month ago, so they're fully vaccinated. My 5-year-old grandchild just tested positive and their family is quarantined. Do I need to quarantine?
So the recommendation at this point is you're fully vaccinated. And so the 5-year-old who may not directly be in your household, well, let's say you are in communication or in contact, you can observe yourself for symptoms, but you don't need to quarantine the way we did before we had such good numbers. The vaccine is pretty profound in that you can be around people who have had COVID. If you're unknowingly around them, you don't need as much of that time for quarantine, and you don't need to go get a COVID test. Just watch yourself for symptoms.
And do they watch for just like a couple of days?
Yeah, just a couple of days. Keep your mask on. And that's the key is once you're concerned, stay home if you don't need to be around other people, and then keep your mask on. But you can continue going to work if you're already working. Wear your mask.
Okay. This person is asking, is it safe for breastfeeding babies and women?
Yes. So vaccinations like COVID, although COVID is new, it acts the same way. You make an antibody in the mother shares the antibody with the baby. And since the baby can't get the vaccine directly, it's actually a beneficial thing for babies to get breast milk that has the COVID antibodies in it. Now remember, antibodies don't make you sick. Antibodies protect you. And so we do want to make sure that lactating mothers understand that the vaccine is safe to take and that the antibodies that you make go to your baby and keeps your baby protected.
All right, so this viewer is asking, is it safe to get a shingles vaccine 2 weeks after I've had the second dose of the COVID-19 vaccine?
So the shingles vaccine can have, similar side effects like body aches, and we won't know exactly which vaccine is causing those symptoms. And right now, a lot of the data is still being tracked. And everyone who gets a COVID vaccine gets a card and you can report any symptoms that you're having. So we just like you to delay at least a month so that we can figure out what are those symptoms and side effects that are due to the COVID vaccine. And then you can get your shingles vaccine after.
All right, you touched a little bit about how you may have some side effects after the vaccine. This person is asking, how long can you have symptoms after you've been diagnosed with COVID?
So there are two groups. There are the people who have symptoms that so they're the asymptomatic group or mild symptoms such as the lack of taste or smell. However, some people are saying to me that they might even go 4 months without returning, that the taste doesn't come back right away. And sometimes it's the last thing to come back. I'm seeing people also with some memory issues as well, and a few people still with COVID toes who had COVID in December. So it's variable, but you can have this long haul symptom where you can have symptoms up to a year. This is why it's so important to make sure you take your vaccine. But I am seeing patients who are explaining to me the symptoms are ongoing and they still haven't resumed taste.
Just that to me right there, not being able to taste or smell for a year would make me want to get the vaccine. And so maybe that's the answer to this next question. This person says, my 25-year-old has a wait and see attitude. How can I help change her mind to get vaccinated?
I think just having a candid conversation about your fears. Sometimes, young people feel invincible. They have not been sick and they're not the ones that we keep talking about, but we have seen young people sick and also die from it. So I would say having a candid conversation of, I am worried about you, and I'm also worried about what could happen to me. But bigger than that, what if you couldn't taste for a year? What if the things that you like to do, you couldn't remember? What if your toes hurt all the time? What if you had back pain and stomach pain and irritable bowel syndrome that does not go away? Wouldn't it be worth it to just get this vaccine? And many times when they think about it as, what if that happened? Put myself in those shoes, we can see a difference.
All right, so this next question is, are shots number 1 and 2 the very same medication, or are they different medical combinations?
It's the same.
Okay, so there's nothing, one's not more potent than the other.
Right, and I know sometimes patients think that the first one will be stronger than the second, so they want to skip the second dose. It's really important that you get both doses if it's a 2-part vaccine. Johnson & Johnson is a 1-part vaccine, but the rest are 2 series. Don't think that the first dose is stronger and the second one is just a little one. They're equal.
Okay. This person is saying, I had blood work done and they said I had COVID-19 antibodies. I never even knew I was sick. Can you tell me why COVID bothers some people and not others?
Well, I think that's just the variability of this virus and why it is such, a dangerous one. Because while somebody is lucky enough to not have any symptoms, the next person could get, complete kidney failure, respiratory disease, could have a blood clot and a stroke. And we just don't know who will be the one to die from it and who will just have mild symptoms and never know. So that's why we really have to take this so seriously, because so much is at risk.
All right, this person says, if you had COVID and a bad reaction to the first shot, will it be a worse reaction to the second shot?
Not necessarily, but you might notice that you have different symptoms with the second shot, or you may have symptoms sooner because your body's already primed. So I had a patient who had really bad headache and dizziness after the first vaccine, still got the second vaccine because he knew that it was really important to get it. And he said that it was almost immediate, felt like he was just tired and sluggish. When I got my vaccine, my initial reaction was a little sleepy with the first one. A few days later, I was a little sleepy. I felt like I could take a nap as soon as I got my second dose. And it's just that your body's primed to it. I want to see those reactions because that tells me that your immune system is already ramped up. So that's not a negative thing.
Okay, really quick. My son-in-law has type O blood and doesn't think he should get vaccinated.
There's no basis on that. No, blood type has nothing to do with it.
All right.
Vaccinated.
We're able to answer that quickly. Thank you, Dr. Stallings. We appreciate it. Yes, if you missed any of this information, you can find it in the website under the Two Wants to Know section. WFMY News 2 at 6 is next.